If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today, and this is our 15th season. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, by calling the live phone line at 718-499-6101. And second, you can email us your questions to askthedoctor@netny.net, and we'll bring them into discussion. Now, for this season only, you have the Net Viewers Survey. And if you haven't done so, please take the time to participate as you wait to go on the air. Now, this survey is here because we want to give you a chance to officially and anonymously sound off your opinions about Ask the Doctor and net programming in general. Now, for those who cannot get through and are not on our mailing list and don't feel comfortable with the computer, please write to Net at 1712 10th Avenue, Brooklyn, New York, 11215, and ask to have the survey mailed to you. Of course, you can participate online at netny.net, and thank you. Now, also for this season, support Net and Ask the Doctor by pledging $60 or more to Net, and we're going to send you a limited edition t-shirt. And I have this here. This Chinatown, they've been working like this, mad to get this thing done. Look at this here. Now, on the back, Ask the Doctor, be proactive. On the front, protect, and exercise. It's a magnificent shirt. What do you think, Dr. Saylor?
I think it's great. I think Dr. Saki will be happy that it's a heart. I would have liked it to have been maybe lungs and a heart, but...
And Mike would like a brain. But we're working our way down. But you don't want to get the rectum show, so you get in quick. But I want to tell you, a lot of this confusion last week. We showed this and said $60. It's not $60 for this shirt. If you contribute to the Net and mention Ask the Doctor and you happen to contribute $60 or more, you get this. So it's just something, they're flying off the cake. You can't believe the sales that have been going on in this. So we work to, and remember, accept no imitation. This is 100% cotton shirt. So make sure, and if you order it just tonight, I'm going to autograph these. What do you think of that?
Great.
Very good. See, Dr. Saki's got his hand in his pocket. No?
My pleasure.
Thank you. Okay, so we're going to mail these shirts out as soon as we receive your payments. Okay, it shows you what we think of the audience. We won't mail it out until we get that money. Now, remember to say, Ask the Doctor when you send in your payments. Very important, so we know we're going to give you the shirt. And then, as always, thank you. Now, for this episode, we have Dr. Michael Ayad. Now, I want to tell you what he does. It says vascular neurosurgeon at New York Methodist Hospital. This is a man who can, if you have a stroke, he can get in there and actually reverse the stroke in many cases if you get there in time. We're going to talk to him a little bit more. So think of all your stroke questions and related to headaches and arteries in the neck. We got a whole lot to talk about. Dr. Anthony Saylor, who's a pulmonologist at New York Methodist Hospital, on the Board of Trustees in addition. He's very modest, but the only physician on the board is a permanent member. And he's been on so many times. I know we're going to get a lot of questions about this cough that's going around. People are coughing all over the place. I want to get to that in a few minutes. And Dr. Saki, who came on as a surprise guest a year ago and made such an impression on everybody that we want to have him back. How many, 3 times already?
3 times.
Amazing. So this is, I feel like privileged to be with you guys. So thank you very much. Now, in the news, we got to take care of business before we get to this stuff. In the news, daylight savings time may cost more than it saves. Interesting topic. You switch the time by now and you mess up the body's clock. And the body has a clock which has hormones involved and light and so on that makes you run on time. You move it 1 hour ahead or back, you get a little agitated and things don't run quite as well. And particularly due to the loss of light, because you have an hour fewer of light at the end of the day, there's a lot of depression going around. Actually, suicides peak this week. This week's suicides peak. Car accidents and workplace accidents. The only advantage, it seems like this past Monday was the lowest day for heart attacks. It seems because of that extra hour of sleep that you get on a Sunday night, that you go into work less anxious and that this extra hour of sleep helps. So it's interesting. Monday traditionally is the leading day for heart attacks. This makes it a little bit less the daylight savings time. But it does, it's funny how the body is affected by the environment and its clock. So just take it easy. That's the best thing to do. Should correct itself in about a week. Number two, I mean, you have children with temper tantrums, and what do? And traditionally you say take a time out, tell them no television, put write on the blackboard or something, a chart. Interesting story out of the paper today, a study done at Harvard and Yale, point out, they gave you some tips on how to stop the child from having a tantrum. And some of the tips are point out children performing the desired behavior. So if you want your kid to put on his coat and he's not, but the kid over there is doing it, say, look how nicely that kid's putting on the coat. Model the behavior you want your child to perform. So you don't want to start acting rambunctious and then you tell your kid act calm, that he's watching or she's watching you, so you want to do the type of behavior. The tone of your voice, change the tone of the voice. Praise desired behavior and don't be negative. And if all else fails, just wrap them across. No, you don't want to do that. Don't do that out here. But this temper tantrum can be very frustrating. It's an interesting study, and I'm going to talk about it in the tablet next week. So if you want to hear more about how to stop temper tantrums, just read that. Another story, very interesting, obesity in children. How can you tell if your child is going to be obese? 10% of kids starting kindergarten are obese, which is a scary number, right? You got heart disease and all this problem. They say that if the child passes 2 percentiles in any period before the year of 2 years old, so in other words, you bring him in at 3 months and he's passed the 15th percentile and the 30th percentile, he's jumped to the 40th, this kid has a 50% chance of being obese. And what you do is you stop feeding him the juices that are, rich in this sugar. You get him out of the playpen and you let him crawl around a lot. And you watch the diet. Of course, breastfeeding, if you can do it for the first 6 months, is always preferable. But it's interesting. How can you, since we're seeing so much obesity, this may be of help. And ask your doctor about this one. And lastly, antibiotics. And I think Dr. Sale will probably talk about this a little bit about. People are giving out antibiotics a lot of times when it's not indicated specifically, may give it out to appease the parents. And this is for kids specifically. 10 million doses of antibiotics that were deemed to be unnecessary in this study. They studied 45,000 kids. It's a big study. And they were given it for asthma, for sinus, for pneumonia, for cough, things that didn't have a definite bacterial cause. And I want to get into this in a little while. So I think basically as a parent, I would question the doctor, why am I getting the antibiotic? Rather than going and demanding, I've been waiting 2 hours to be seen, how come I didn't get an antibiotic? So you want to realize that this can cause complications for the child and also for the population in general by getting bacteria that aren't susceptible to antibiotics. So anyway, that's what's in the news. I want to thank Monsignor Bennett, who's sitting there over there. He has a little cough himself. I'm going to ask you, Monsignor, glad to see you here. Come out on a night like this with a cough. We appreciate it. We had some sad news in Brooklyn. Dr. Peter Mastrorocco, who was on the Board of Trustees at New York Methodist Hospital, a well-known optometrist and just a great guy, had tremendous advice, practical advice, and he took the time to talk to people. I know he came by the first day that I got to the hospital in New York Methodist and told me a little bit about what's going on and really put me at ease. So it was a really sad event to see him go, and we're going to miss him.
He's a wonderful man.
We had a call last week, Julius, from last week, and those who watch the show know live TV can be a little bit tricky, and Julius called with kind of a sad story, and we didn't do him justice. We couldn't talk to him as much as we'd like to. He was very lonely. One thing we wanted, if Julius doesn't get through, 1-800-LIFENET is a line that people can talk to, problems they can spend all day on the phone. It's a little tough on this live TV because we just don't have the time. We have to get off the air. So if Julius can call back, we'd like to hear from him. But if not, 1-800-LIFENET. You spell L-I-F-E-N-E-T, and you get to talk to someone if you're feeling low and you just feel like things are going the wrong way. You got to talk to somebody. I want to say hello to three actually loyal listeners. Elaine and Lenny Jarko watch the show every week. I want to thank them. They're down in Sheepshead Bay, Manhattan Beach area. And Margaret Fitzgerald, who called up today from Manhattan. It was great to have her on board. Now, the quiz. I know people have been waiting for this, so get your pencils ready. Here's the question. According to a prominent study, what is the most popular name people pick for their pet dogs? Okay? According to one prominent study, what is the most popular name people pick for their pet dogs? The number to call is 718-499-6101. With tonight's topics are the strokes, lung disease, and heart disease. Remember, you can email us your questions to askthedoctor@netny.net. And please take the survey, give us good grades on there, because they're looking. The management wants to know which shows you want, and the ones you want are going to continue, and the ones you don't want are not going to continue. So we need the feedback. So anyway, don't go far. We have a great show. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctors, where our topics are strokes, lung disease, and cardiology. Now let's meet the doctors. Number one, Dr. Mike Ayed. Hello, it's great to have you on the show.
Great to be here.
And you came quite a long way to be in Brooklyn, New York.
I came a ways, yeah.
Give us a quick background, where you started and how you got here.
I did training in California. I'm an undergraduate, graduate medical school, and then I did neurosurgery residency in Washington, D.C. And then I did a fellowship at Vanderbilt in Nashville, Tennessee.
What are you, 100 years old?
Yeah, that's what my wife tells me.
Yeah.
She says when I told her I was going to do a fellowship, I thought she was going to strangle me.
Wow.
After that. But I stayed on after fellowship for 4 years, and then thought this was a great opportunity at Methodist. And so I've been at New York
You
Methodist.
were at Vanderbilt, right? Before
Vanderbilt for 4 years.
Where's that? Which part of?
Nashville.
Nashville. You ever get to that? Who's there buried there? What is that guy's name?
Oh, Elvis?
Yeah.
That's Graceland. That's actually Memphis.
All right. You see,
close enough.
Take geology for 10. Okay. But it's great to have you on board. And you're going to talk a little bit about strokes.
I am.
And what can you do for people if they come in time?
That's right.
How fast do they have to get there?
Well, it's better to phrase it this way. Every hour or even minute that's delayed decreases the chance of getting function back. So if they can get to the hospital promptly, we have a rough cutoff about 6 hours, 6 to 8 hours. And beyond that point, it becomes very high risk to try and open up the artery.
So if they can get in a reasonable time, you can sometimes get in there and make things better.
Yes.
Wow. So this is something, and I don't think, how many are doing this in Brooklyn, for example?
In Brooklyn, well, we're actually right now, there were a couple of centers that were doing them and are not doing them currently.
So it's good. I mean, you're still doing them.
Mm-hmm.
Interesting to know. People have to tell the ambulance I want to go to there, or how does it work?
The ambulance makes the call in many circumstances. They need to go to the closest stroke center, and typically one with interventional treatment, and they can make the call.
We're going to get into this in a little while. Dr. Sale, it's great to have you back. Still mourning about the Yankees.
Terrible. Very
what's going on there?
As you said, they were built for the regular season.
They're built for like the Atlanta Braves.
Right.
Right. So what sport do you follow now?
Well, I miss basketball with the strike. That's
college basketball.
College basketball.
St. John's?
I'm a Giants fan, watching the Giants. They beat New England the other day.
That was a remarkable finish.
Yes.
I was at the Ranger game when that happened. Yeah. You ever go to hockey? Or?
Not too often.
Yeah. Okay. Do you skate at all?
No.
No. This is. Okay. Anyway, Prospect Park had a nice skating rink.
Yes.
I think they're redoing. I had to ask you a question. I hear this coughing. I don't know if we muted. A lot of people are coughing. I was out with a guy, Ed and Elaine, last night in La Grenouille, fancy restaurant. I like that. I stepped up a little from Gino's. But it was delicious. The guy can't stop coughing. It's a dry cough. And he was given antibiotics.
Right. Probably he didn't need antibiotics. We'll maybe get into it a little later. But many people who have cough have either a cough from the upper airway, what we call postnasal drip syndrome, now called upper airway syndrome. Patients who actually have GERD or reflux cough a lot. So there are many, many non-infectious causes of cough. So a very thorough evaluation is mandated in these patients.
And how long does it usually last, this kind of, well, I guess it depends.
Right, depends. Sometimes it may last for years.
Wow. So we'll be taking those questions, asthma questions, pneumonia shots, who should be getting it and so on, you know, just so get your questions ready. And Dr. Sacchi, it's a pleasure to have you back.
Thank you.
Any advances since we last saw you in the field of cardiology?
Well, you know, in prevention, we made quite a bit. The good news is that the mortality from cardiac disease has diminished, and it's a multifaceted approach. But a lot of it has to do with prevention and patients being made more aware of the risk factors and paying more attention to them. So I think that's the good news in cardiology.
This is very good news. So without further ado, I mean, we've got so many people. Let's see who's the first. Could it be Maddie? Could it be Grace? Patrick? Hello?
Hello, Dr. Garner.
Maddie, how are you?
I'm hanging in there, Dr. G.
It's good to hear. What do you think of beautiful weather, huh?
Yeah.
So have you been bothered by this cough at all?
Yeah.
You have? So Maddie's on the 14-second delay.
A little bit,
The rest of
not
the show is a
much.
7-second delay, so that's
But
the
when
problem.
I'm walking,
Yes?
I get out of breath with very little walking.
Okay, maybe it hits Dr. Sacchi and Dr. Saylor. Maddie's walking and gets short of breath.
You know, that's a very common symptom, Maddie, and it doesn't necessarily imply that there's any lung disease or heart disease. Sometimes it could be a matter of conditioning, you know, how difficult it is for you to walk. Perhaps there's you have some arthritis. So I think you need to check with your doctor and to be sure that the symptom is manifest of either pulmonary or cardiac disease.
So I hope that helps, Maddie. Dr. Saylor, any
Thank
lung?
you.
No?
You're welcome, Maddie.
Maddie,
Good luck.
great to
Yeah,
hear from you.
thanks.
Take care. Maddie's always very loyal to the show. And Grace, another loyal caller. Hi, Grace.
Yes, hi, Doctor. How are you all?
Very good. How are you tonight?
Yeah, well, I'm hanging in there.
You doesn't sound too happy tonight,
Remember I
Grace.
spoke to you, I think, a couple weeks ago in regard to, like, electric shocks along my mouth into my nose. I went to the dentist. I kind of figured he wanted me to go to a neurologist, but I said no. I waited a while, and then I figured my dentist needed adjustment because I have my dentist 5 years, and he cut it down a little, and I feel much better.
Excellent, excellent. We're
But
glad
I
you feel.
really wanted to ask a question about my husband, but you never have ophthalmologist on. When can I call about? He can't read, and he had his cataract taken out about 5 years ago. It was a success. He was born with cataracts on both of his eyes as a child.
Interesting. So
And
what we're going to do,
he had so many
Grace?
years, and he took it out. He's going to be 79, and it was a successful operation. He can see good, but the thing is, he cannot read now. And he's been going to ophthalmologists, and they found fluid, and they gave him Avastan injections.
So Grace, let me tell you, because we got to run. We're gonna try and get an ophthalmologist. My daughter's an ophthalmologist. I'm going to ask her the question and come back next week and give you the
wait a
answer.
minute. Can I ask something about me? I'm getting a snapping sound in my neck for about 2-3 weeks, like when I turn in the bed or even on my recliner.
Grace. Before I get to that, I'm going to get to that. Do you have a question? Do you have an answer to the quiz?
Well, give me the quiz
What's the
again.
most popular name for a pet dog?
Well, that's a hard one, but as a quick thing, Lucky?
Oh, Lucky. Lucky. Is it Lucky? There it is. Oh, Grace. Lucky. No. Did you ever have a dog named Lucky? No, Grace, it's too much. It's too much to strain. Okay, who are we going to go to next? Let's go to Larry. I wonder if this is Larry from Chelsea or Larry from Rockland County. Hello?
Yeah, hi.
Hi, is this Larry from Chelsea?
Yes, how are you, sir?
How are you doing? Very good.
Good.
How are you doing tonight? What's your question?
Okay, my question is, I'd say every other night practically, I'm just saying it happened a few times, I woke up in the middle of the night, my heart racing. Could that be sleep apnea?
It's possible. It's not. It's certainly, if that was part of the syndrome of sleep apnea, certainly at some point, the heart rate and arrhythmias or a change in the rhythm of the heart is part of that syndrome. Dr. Saylor is an expert on sleep apnea, and I think he could address your question as well.
Thank you, Larry. Certainly a rapid heart rate, if you have severe sleep apnea, may be a complication of it. Now, do you snore loudly? Do you fall asleep easily? Those are some questions that I think would help. And if indeed, Larry, the answer to those questions is yes, then you should see your physician and have a formal sleep study where we would be able to definitively answer all of those questions for you, Larry.
Yes, I think it's yes to both those questions.
So, Larry, I suggest you see your physician and tell him about your symptoms, and he could arrange for you to have a sleep study. I think that would be a great idea for you.
Okay.
So give us a follow-up, Larry, okay? You have
You're
a quiz, answer to the quiz?
Yeah, I think it's my dog's name, Max.
I think it's his dog's name, Max. Could it be... This is amazing.
Wow.
Larry, did you check this out on the internet?
No, that's my dog's name.
Amazing, amazing. This is, I just want you to sit down because a lot of people get this shakes when they get, we haven't had a winner like this so close to this beginning of the show. It's amazing. You know what you win?
What?
There's a beautiful plaque, handmade plaque in Japan, and it says, ask the doctor on it, and you drew a winner. Only about 25 exist right now.
Wow, that's wonderful.
Where's it going?
I'm very honored.
Larry, where would it go in your house? Do you have a place picked out?
Yeah, I'm going to put it right in the living room on top of the mantle.
This is great. This is great. So hang on. We're going to get your name and address, and we'll send that off to you. It should get there in about a week, okay?
Thank you.
Take care, Larry. Feel better.
Great show.
Thanks a lot. We can put Larry on hold, and we'll go to, if I cut you off, Larry, just call back. We're going to go to Irene. Irene?
Yeah, he took my name, Max.
Oh, Irene.
Did you ever?
I know, and I'm sorry I even asked. I asked, you're waiting, and you had it, but there's nothing I could. Let me ask the judges.
All right. If not, I mean, I'll do a medical question. But...
No, the judges say no. I'm sorry. I'm sorry. But let's hear a medical question.
Sunday and Monday, when I was walking, you know, my equilibrium was off, and I don't know what that means.
So you just felt a little unsteady on your gait?
Yeah, I was like walking unsurely, you know, not securely.
Okay, and I want to ask Dr. Ayad about this because I would like to know, you know, we talk about strokes and getting there quickly. Is there a way to know you're going to get a stroke? And could this be, this dizziness, imbalance, be a warning to her?
Dizziness alone is quite rare to be the cause of a stroke or a TIA. TIA is the name for a mini stroke where there's not actual damage, but it can be a brief episode where there's some of the similar symptoms. In fact, when the world is spinning around, something we call vertigo, there are some cases where it can be due to not enough blood flow to the brain. The vast majority of them are due to disorders of the inner ear that controls equilibrium. And if you have other symptoms other than the dizziness, then definitely promptly come to the emergency room. Otherwise, see your primary care doctor, and probably a referral to an ear, nose, and throat doctor would be the next best step.
Okay, thank you.
Irene, sorry about that.
Okay, that's okay.
Next time I'm not going to ask like that, okay?
Okay.
Okay, take care. We'll go to Patrick now. Hi, Patrick.
How you doing, Dr. Rana?
You had the answer to the quiz, too?
Nah, I was going to say Spot.
Spot. Spot was up there in the top 5, yeah.
I wouldn't have it. Dr. Garner, like you were saying about that time of the year with the sunlight.
Yes.
It so happens Monday and Tuesday this week I've been really sick.
It's interesting.
And, you know, I've been getting lightheaded again. So.
You know, it's interesting. Turn down the radio a little. Turn down the TV, Patrick, because I can't hear the feedback.
Okay.
But Patrick gets these symptoms where he gets very dizzy, lightheaded, also palpitations, and I don't know. Do you want to weigh in on that, Dr. Sacchi?
Well, it's a broad symptom complex, and it could be something very, very innocent, or it could be a manifestation of something more significant. Again, I think this forum is hard to kind of make a diagnosis and be more specific, but clearly I think, as was mentioned before, seeing your primary doctor, getting a little bit more formal assessment, then would get you in the right direction.
And Patrick has had counseling, which, you know, to try and help from psychiatric approach to see if this could be related to a mental disorder, which it can.
Well, it certainly can, and certainly is in part of the differential diagnosis.
Patrick, how's your cousin?
He's doing good. My nephew's doing good. I told you he had that problem with that plane.
He was on the plane in Connecticut. How long was it on the runway?
Like 11 hours.
11 hours. And is he paraplegic?
Paraplegic, yeah.
Paraplegic. It was kind of a scare for the family again. Young guy.
Yeah.
But
Everybody is doing okay, but I appreciate that, Doc.
very good, Patrick. Hope you feel well. Have a good week.
You too, buddy.
Take care. What we're going to do is we're going to take a short break now. But before we do that, I want to remind our viewers about the survey, the NET survey. If you're so inclined to support the NET also and do the survey, that's tremendous. Now, this is the deal. You take the survey, you tell what you think of Ask the Doctor, and it'll probably come back next year. If you don't, we may not come back, so it's important to do. The next thing is we want you to contribute to NET to keep this station going. You know, there's cuts, budget cuts all over the place. If you give $60, we sweeten the pot. $60 donation to NET, tax deductible, gets you this shirt, which what does that say, Dr. Zeno?
Protect it, don't stress exercise.
Look at that. Protect it, don't stress exercise, and?
Be proactive. Ask the doctor.
So for your donation of $60, you're going to get this shirt. Again, it's rubbing off of me, this black. I don't know what that is. Okay. You can call tonight to make your pledge to support the NET and reserve your shirt. Now remember to mention Ask the Doctor when you send in your support. I want to thank you. Now tonight's number is 718-499-6101. The topics are stroke, lung disease, and cardiology. And the quiz has already been answered. So take a break. Don't go too far, though. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are strokes, lung disease, and cardiology, heart disease. We have Dr. Michael Ayad, Dr. Anthony Saylor, Dr. Terrence Sacchi. Now let's get to the questions. We got Mary. Hi, Mary.
Hi.
Hi, where are you calling us from?
Bed-Stuy in Brooklyn.
And so, Mary, what can we do for you?
I was having headaches, and I went to a neurologist, and they told me I have a meningioma. I think that's the way you say it.
Okay, I'm gonna ask, so you want to know a little bit about it?
Yes, I do, please.
Dr. Ayad is the perfect guy for this.
Mary, meningiomas are slow-growing, benign tumors, and they arise from the covering of the brain. They don't actually grow into the brain themselves, into the tissue of the brain themselves, and they can cause symptoms because they put pressure on the brain that's next to the tumor. Generally, small meningiomas, there's no surgical treatment indicated for them.
But Mike, is this giving her a headache?
Well, now I don't get headaches now. During the summer, I used to get them.
Mary, it's hard to say. It's rather unlikely because they grow so slowly. They generally don't cause headaches because the brain sort of adjusts to the growing, slowly growing size of the meningioma. But certainly if you have any new symptoms like weakness, difficulty speaking, something like that, you should be promptly seen by a neurosurgeon.
Okay, does it grow and you got to have surgery?
Not necessarily.
Oh, okay.
People can have meningiomas that can stay the same size for years and years and years. Okay,
that makes me feel better.
It's good news, right?
Yes.
So it's benign tumor, slow growing, excellent. So Mary, we thank you and hope you're going to call back and hope you do well.
I'm going to call you back because I have some more problems.
Okay, so save them up. We'll talk to you next week.
Thank you very much.
Take care. Hi, Alex. How are you?
Good.
Hi, Alex. Where are you calling us from?
Crown Heights, Brooklyn, New York.
Crown Heights. And what is that? The name is Alexandra?
Alexandra.
Very
correct.
nice, very nice. Any places out in Bed-Stuy since we last talked, or no? Or Crown Heights?
No, I never called before. This is my first time.
Yeah, yeah. There's still no restaurants, though, are there?
There's a few.
Where?
A lot of West Indian restaurants.
Okay, what's the name?
You have Sally's. That's in, well, that's really in Canarsie. Sally's is a Jamaican restaurant.
Uh-huh.
Yeah, they're pretty good.
Very good. So there is nothing really in Crown. We keep trying for Crown Heights, but there is. So what can we do for you?
Okay. I was diagnosed with the thyroid problem about 1.5 years ago, and I have cholesterol, but I take the lowest dosage for both Synthroid and Simvastatin. About 4 months ago, in the morning when my body's beginning to wake up, my right hand is very, very stiff, and when I try to clench it and make a fist, it's a little painful, but as I get up, it goes away. So I was a little concerned if this had something to do with, I don't know what. It's just something that happened about 4 months ago. So I was just concerned. I went to my doctor. She did X-ray, everything. They don't find anything wrong.
Let's try and get to the bottom of this. Let's start with Dr. Ayad. The stiffness in the joints.
Well, the thing that first caught my attention was that you mentioned that it was when you woke up in the morning. And very commonly, just from the position, from how you sleep, can shut off blood flow to your arm if you're sleeping on it wrong. Or it can cause pressure on one of the nerves that travel down the arm. And if it resolves during the day, and it doesn't occur during the day,
no, it's just
you might,
in the morning.
Yeah. That's what comes to mind.
But I've even, people said maybe it's the way you sleep, but even if I sleep on my back, I'm conscious of it. It happens, and I'm, a little worried about that.
Well, it sounds like Dr. Sakiasela, you want to weigh in on this?
One of the concerns that might be, could be some arthritis, perhaps, something, and which sometimes some arthritis is worse in the morning, a little bit stiffer, so that would come to mind too. Although the fact that it gets better during the day.
Yeah, as soon as I get up in the morning, it's gone.
Right. So that somehow, it tends to me that it's nothing significant or nothing that's more of a local phenomenon, as Dr. Ayad pointed out, and I would focus more on that.
How old are you? How old?
A young 51.
Yeah, you sound very young. I want to ask, what about any heart? What would you expect? Thyroid and heart disease?
Well, certainly, if the thyroid function is elevated, hyperthyroidism, that is oftentimes associated with rapid heart rates. Atrial fibrillation, which is a very common arrhythmia, is associated with that. And is usually easily controlled once the diagnosis of the thyroid problem is made and it's treated. But if the thyroid is underactive, usually the heart rate gets to be a little slower than normal. But usually those are the extent of it.
Sandra, thank you so much for the call.
Okay, thank you. Have a good evening.
I got to go, before we go to Rosemary, I got to ask Dr. Sela, does it seem like asthma is increasing, or the number of cases increasing?
I think what's increasing is our awareness of it. I think our antennae are up, and as you mentioned earlier about cough, actually the third commonest cause of cough is asthma. Right. So many people just have this troublesome cough, and you've excluded sinus or nose issues, you've excluded GERD, and then you have to think of asthma. So I think asthma is a very common disease that we see extraordinarily frequently, but I think our recognition of it is getting better.
Let me ask you a question, because the guys here and the camera guys having this cough, they're basically healthy, they have a cough. Is there any medication over the counter you would suggest that you'd feel comfortable saying?
There is no over-the-counter medication that is really effective for cough. The best medicine for cough is to figure out why you're coughing and then try to tackle that issue.
Can a cough ever represent, I guess anything could ever, but is it likely that it could be a serious?
Absolutely. People who smoke can get lung cancer, they have obstruction of their bronchial tubes, patients can have emphysema, pulmonary fibrosis. A cough could range the gamut from a benign little tickle in the throat to a life-threatening problem.
So you got to get into the doctor and see what's going on. Okay, we're going to go to Rosemary on line 2. Hi, Rosemary.
Oh, hello. How are you?
How are you tonight?
Oh, fine. How are you?
You didn't order the shirt yet, did you?
No. But I'm going to. I just told my husband. He goes, "Oh my God, $60." That's what he said.
No. It's $60 to net. Don't forget. You're keeping the good work going of net.
Yeah, that's what I told him.
Right, and then
he
also.
said, "Oh, he almost had a heart attack.
I know. We've got Dr. Saki
But
here.
don't worry, I handle all the money, so we're going to get that shirt.
And I'm saving one for you.
Oh,
actually.
you save one for me
They're
because
flying
you
off
know
like
me.
a-
I'm going to get that.
Thank you.
What I wanted to say is, and I saw somebody on the Fox
Oh, you caught
channel.
them. Look out.
I couldn't believe it. There you are. I said, what a big shot you are. You're everywhere. I said, oh, there you
He's
are.
our favorite guest. Our favorite.
Anyway, and another thing, someone wrote in the tablet a little. That's what my question is about that broken heart.
Oh, yeah.
Isn't that something? Because this is why I want to see what you people think about this. Because this happened to my mother. My father passed away, and within 3 months, she had a problem with her heart, which they thought was a heart attack. I don't know if it was the enzymes. I don't know how they came to that conclusion. She had an angiogram, and she had no heart damage at the end of the whole story. She went through everything, and the angiogram, and it wasn't even any clog or anything was clogged. But they never mentioned that, But maybe we didn't mention that my father had just passed away. I don't know.
It's interesting, and I don't know if every cardiologist believes in it, but at Johns Hopkins, they're very into this diagnosis of broken heart syndrome. Dr. Saki, you want to touch on that?
Yeah, surely. This is a real entity. It's in the literature, it's described, and it usually surfaces in around both men and women. Around the death of a spouse or traumatic episode in the family. And we've had several cases at New York Methodist where patients, different age groups, women usually under great stress, have a heart attack. And we do the angiogram, and actually they do not have obstructive disease, which we commonly see. And it's felt to be due to stress and hormonal changes. But it's a real entity, and it definitely exists.
Oh, thank you.
We had someone in the tablet that she was saying lost a dog.
Yes, exactly. I always read the tablet.
It's clearly centered around some kind of stress, emotional stress.
That's just how it happened with my mother. Within a couple of months after he died, she went into this thing which we thought was a heart attack, but she has no heart damage.
Yeah.
She did all of the tests, and everything came back. But she's still on the medication, blood pressure, cholesterol, whatever that is for the American Heart Association, what they tell you to take.
But anyway, Rosemary, thanks so much for the call.
Good to hear from you.
Have a good week. See you on Fox.
Bye.
Take care. Okay, let's go to Sharon now. Hi, Sharon.
Hi, how are you?
Hi, where are you calling us from?
Midwood.
Oh, Midwood. Now, what's out there in Midwood? Any restaurants over there?
I don't like the restaurants here.
No, you got to get in the car and go somewhere, right?
Yes, I do.
I ate at a nice restaurant last week, Sorrentino.
Where is that?
Where's that, Tony?
Sorrentino.
Sorrentino
in Bay
Ridge.
Bay Ridge, yes.
Bay Ridge. Oh, okay.
It was nice. One of these old world Italian restaurant places.
Very friendly.
They have the whole block. Very friendly. They accommodate you.
Family restaurant.
Nice family restaurant. Sort of like Gino's, without the attitude. No, Gino's is a nice place. Right, Gino's a good place. Yeah. So what can we do for you?
Okay, question regarding my son, who was 34 years old. About 8 weeks ago, he had extensive dental work, 8 fillings, sedation, dentistry, gum work done. He was sedated for about 4 hours. About 2 weeks later, he developed a terrible cough and a cold and coughing up blood, very congested. Went to the doctor. They put him on Levaquin and prednisone. It's not getting any better. They did a X-ray and they discovered it's small pneumonia, probably from inhaling a toxic substance, which they referred him to a pulmonologist. But do you feel that the procedure that they used a filling that's not metal, what do you call it? I can't think of it.
Some kind of a metal filling. I wonder
no,
if
it wasn't metal. It was
some kind of porcelain?
Well, yeah, it was a white filling. Otherwise, it'd be all.
Let's see what Dr. Saylor thinks about this.
Well, first of all, I hope he's feeling better. And I can tell you he probably will get better. It sounds like anytime you undergo any sedation, be it full general anesthesia or even what we call conscious sedation, every once in a while there's a risk of developing what we call an aspiration, which is when some of the oral contents, instead of getting in your saliva or you spitting them out, sometimes you can inhale them into your bronchial tubes. They can get into your lungs and cause a pneumonia. It doesn't happen frequently, but it can happen. Fortunately, it's usually a self-limited condition, and it sounds like they're treating him appropriately and aggressively, and I think he'll get better. You just have to sit tight, keep following with your doctor, and within a few weeks or 2 to 3 weeks at the most, he should be feeling better.
Okay, because it's about 8 weeks now, and
Wow.
I feel that he should have probably been put on an antibiotic the day before the dental surgery to eliminate this type of problem.
Yeah, I mean, I can just comment from the lungs. We don't put people in, we don't give them antibiotics to prevent it. Dr. Sacchi can tell you more about for heart issues, but for lungs, we don't typically give antibiotics. But it's taking a little longer, but he still should get better. And
Okay,
make sure, I'm sorry?
No, what's the difference between pneumonia and small pneumonia?
A small pneumonia just means it on the x-ray, it's probably a very small patch in the lung. It's not a diffuse pneumonia. And again, that should get better. You should sit tight and support him through it.
Okay, thank you.
Thanks so
You're
much.
welcome.
I got to ask Dr. Ayad while I have him here. Strokes. You know, we hear about this in old and young people. Just for people that don't know, what is a stroke, and what exactly do you do that undoes it?
Great, thank you, Steve. Strokes are injury to the brain that result from not having enough blood flow to the brain. And some of the common symptoms, the most common symptoms are temporary or permanent weakness, one part of the body, numbness, difficulty with speech. There can be drooping of the mouth or the eyelid, and it's caused by a blockage to an artery that can come from one of 3 places. Commonly, it can be thrown from the heart. There can be a blood clot sitting that's within a portion of the heart that's not beating properly. It can come from a blockage in an artery in the neck, and it can also cause by disease within the arteries of the brain. And the latter we can't do so much about, but if there's a blockage that comes from the neck, we can sometimes open up that artery in the carotid artery. We can pass an instrument through the blood vessels into the blocked artery to the brain, and we can disrupt that clot and suction it out. We usually have a short window to work in. Like I said, if it's too long after the stroke, the risks of doing that are increased to the point where it's not advisable.
Thanks a lot. What we're going to do, we're going to take a short break, and when we come back, we're going to go to the rapid fire question hour, or 15-minute time period, where our topics today are strokes, lung disease, cardiology. Don't go away, we'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back. Welcome back to Ask the Doctor. Our topics are strokes, lung disease, cardiology, and now we're in our rapid fire segment. We have Elizabeth on line 3. Hi, Elizabeth.
Hi.
Hi, what's your rapid fire question?
Okay, I have a question for the pulmonologist.
Oh, he's on deck right here.
Okay, I have interstitial lung disease, and I have really bad chronic cough, and I've been through all kinds of treatments. I think we've exhausted just about everything. But my pulmonologist had discussed with me that they've done several studies on like very, very low dose antidepressants with people with lung disease, and they've seen benefit of that. And I was just wondering your opinion on something like that.
So, Elizabeth, first of all, interstitial lung disease is a big topic. Do you have a connective tissue disease?
Yes, I have lupus.
Lupus. So lupus with connective tissue disease is very common. The antidepressant is probably just more because sometimes You can get frustrated from coughing so much. I don't think the antidepressant in and of itself has any activity in regards to your interstitial lung disease, but certainly there are medications that can help interstitial lung disease related to lupus. So I think you should see your doctor and see a pulmonologist. And patients who have connective tissue diseases, who have interstitial lung diseases, do a lot better than patients who have interstitial lung disease with no known cause.
Right. I mean, I don't think to date there hasn't been a medication I haven't tried yet.
I'm sure.
Tough disease.
Tough. So what I would do in the fairness of time, Elizabeth, see your pulmonologist, and if you're not happy, speak to your primary care physician. Maybe you could see somebody else.
Right.
Thanks, Elizabeth. We hope you feel better.
Feel better.
We're going to go now quickly to our emails. We have a question, dear Dr. Garner. Is there a new treatment for Tourette's? A few years ago, you had a segment about treatment with antibiotics, I think. Did this work? Dr. Ayad, Tourette's and...
Not aware of antibiotic treatment for Tourette's. One day, some disorders, like this paroxysmal disorders, may be treated with stimulators, deep brain stimulators. There's ways where actually stimulating parts of the brain can turn them off. And I think this is one area that there's some trials going on.
Is this a myth where people are cursing? You know, Tourette's is where you get some kind of tick or you start to...
Not a myth.
They curse in different languages. It's universal?
Don't know about the other languages, but it can be pretty impressive.
Yeah, so, okay, we got to have that 7-second delay in case we get any calls. All right, we're now going to the next question. Hi, Dr. Garner, your program is very informative. Perhaps you can help me. The last blood test showed a cholesterol of 300 and an LDL of 170. And she's taking a lot of fish oil, Dr. Sacchi. Can fish oil reverse the bad effects? I
think it's a little dangerous in this setting with that level of cholesterol. The fish oil is a great alternative. I think many of us believe in it. But with the profile that's here, I think you're going to need more. If it needs to be treated, you're going to need something like a statin drug or more. And I wouldn't. That's a pretty significantly high level.
So yeah, you know, it's good, but it's good to eat fish, right? But
yeah, fish is great, and fish oils are very good.
Okay, we're now going to go to another another email. Or no, hi, who am I talking to?
Maria from Brooklyn.
Hi, Maria. How are you?
Good. I'd like to make a compliment to you and to your brother. I'm a former patient of your brother.
Oh, my brother's a rheumatologist.
Yes. Yes, Bruce Gardner. I had gone to him a couple of years ago
Takes most
for
insurance.
when the Syndex shots first came out on my knee, and he was very, very. I mean, he sang Frank Sinatra with me through my whole
He replaces one pain with another pain. So, if you've ever heard him sing, you know what I'm talking about. But anyway, what's your favorite Frank Sinatra? Yeah, what is your favorite song?
What?
What's your
favorite?
I
had treatments on my knee done. Syndex, the shots when they first came out, and he was at that time one of the only doctors in Brooklyn that gave the shots.
So we're in the rapid fire. So I'm trying to. What's the good question? Okay. All right. So anyway, let's get to our next question. Who's on line 2 here? Hello.
Hello.
Yes.
Is Dr. Garner?
Joe Stiles.
Yeah.
Joe, hi. I have to say hello to you and goodbye because we're running out of time. Is everything okay?
Yeah, but I've been 20 minutes to talk. Is this Dr. Garner?
Yeah, this is he. One of our favorite.
Dr. Garner.
Yes, Joe Stiles. Who's
Listen, Doctor, you make an image your role model, you and your colleagues on this program.
Well,
I'm also a member, reading the Tavern for 70 years, and everybody should read your article. And you and I are part of the network between Methodist and New York Committee. We're part of the New York Presbyterian Network.
Joe, thanks a lot. I got to run, but it's great to hear from you. Look forward to seeing you soon. Great guy. He's on many boards, a lot of community service. Joe, hi, another Joe. How are you?
Yes, Dr. Gardner.
Yes,
Joe
hi.
here from Sunnyside, Queens.
Oh, Sunnyside, yeah. What's out there?
Oh, there's a lot of things out here. Number 7 train is out here.
7, that's a good one. You can say.
Yes, and the Sidetracks restaurant is out here on 46th Street.
Beautiful.
Yeah.
What can
my question to doctors, for you and the doctors, is I've been diagnosed with prostate, cancer.
How old are you?
I'm 67.
Okay.
So what I was in Columbia Presbyterian. I had 14 samples taken, and 3 of them are positive.
Okay.
Okay. So now, doctor, in your column, I read in the tablet and a lot of other information from New York Times. There's so many different conflicting reports, and one of the things they seem to be saying is my numbers are 4.2.
The PSA.
And they say this is not a significant thing anymore. The PSA.
Yeah, I think, I don't know if anyone wants to weigh in, but I think once you have the diagnosis, the controversy is whether you should use PSA for screening or whether that's of any benefit. I think many doctors agree that it's useful to follow the progression of disease once you know you have disease. I know we had Dr. Cheatham. I don't know if you saw her up at Columbia.
No, I didn't.
She was on
Dr. Sherrod there.
Yeah.
And anyway, so he what he said to me was he said to me if cancer is good, you got good cancer. It's not aggressive, and it's wait and see and come back and have another biopsy. But this is what I want to tell you about biopsy. I had the biopsy, which is not a very comfortable thing. Now, I just read, and I have the article, and I'm going to show it to the doctor when I go back to him, the surgeon. They have a new method out now where they shock your prostate, and the scales that come off of it, they pass through your urine, and you save it, or you give it to them. So have you heard of anything like that?
I haven't heard that. But we're going to have Dr. Cheatham back on, and other urologists we're going to have on the show, and Dr. Grunberger, who's going to be back with us very shortly. So just stay tuned in the next few weeks, and we'll get to Dr. Grunberger and get your answer to the question.
Okay. Thank you.
Good to hear from you out there. Take care. Hi, Jim.
Yeah, hi.
Jim, how you doing?
All right.
You might be our last caller for the evening. What's the question?
The question is NPH, if it really works. I heard it on television, and then I looked it up on a computer, and they were showing you people that, went through this process.
Well, we're not sure NPH has so many different abbreviations. Dr. Ayad has an NPH.
Yeah, normal pressure hydrocephalus. Is that the NPH you're talking
What
about?
happens is they put a shunt in the head, the brain, going to the brain.
I got 1 minute. I want to hear from Dr. Ayad. Normal pressure hydrocephalus.
It can be a tricky diagnosis. Generally, we only consider a shunt if somebody has what's called a high volume spinal tap. In other words, taking off a lot of spinal fluid, and if the patient has a significant improvement, then and only then would we really consider them a candidate for a shunt.
I want to thank you for the question, and that's it. I mean, we got a lot of questions, people waiting, but we can't get to everyone today, but we're going to try and get to you next week. I want to thank Dr. Michael Ayad, Dr. Anthony Saylor, and Dr. Terry Saki for coming in. They've been up since 7 in the morning, these guys, and come in. We really appreciate this visit, and we hope we're able to help you. It's good to remember you should be proactive about your health. Speak to your doctors about your concerns. Go for second or third opinions. Next week, we're going to discuss dentistry, women's health, internal medicine, and geriatric medicine. Now, you can visit us at our website at netny.net/askthedoctor. Here you can get the tablet columns, podcast, the forum, email your questions in advance, and participate in our all-important viewer survey. I want to thank those who have already participated. I want to thank Dr. Linda Lapatosa, our quizmaster, for her great question and continued work. And thank you all for your questions. Now remember, tune in tonight at 10 o'clock and you can see encore presentation of last week's show. It's a very good show, so I think you'll enjoy it. I want to say goodbye, stay healthy, and I'll see you in the tablet.